Hello everyone. Let's talk about pap smears today. So what is pap smear? Pap smear is screening test to detect abnormal cells from the cervix. Cervix is the mouth of the uterus which is exposed in the vagina, and it is prone to infections, erosions or ulcers and precancerous or cancerous changes. So any test which detects cervical cancer is very beneficial to us because cervical cancer has a very low survival rate and very high morbidity, which means complications are much higher in even minor cases of cervical or stage 1 of cervical cancer. So how does pap smear work? When you are planning a pap smear, minimum 24 to 48 hours priorly, you should avoid sexual intercourse, vaginal douching, vaginal creams, or vaginal examination to ensure accurate results. When you visit the healthcare provider, they will do an examination of the cervix. So for that, they will insert a speculum gently inside the vagina to visualize the cervix. Following which, they will take either a spatula or a liquid brush to collect cells from the cervix. These cells are then sent to the laboratory for examination. The reports may come back as normal or abnormal. Normal is great, but abnormal is not necessarily cancer. Abnormal may mean there are infections, or there is inflammation, or some precancerous changes, which with adequate follow-up and treatment can prevent cervical cancer. Additionally, with pap smear, we also do HPV testing. What is HPV? So HPV is human papillomavirus, which has numerous strains. Some of these strains can cause benign warts, but there are some of them which are closely associated with cervical cancer. Hence, now there is HPV vaccination, which can help prevent some of these strains from infecting you and being source of cervical cancer. That, however, does not mean that you stop doing pap smears. Pap smears are very essential. So when should we start doing pap smears? Pap smears are done after the age of 21 once a woman becomes sexually active. It is done every 3 yearly if your previous tests have been normal. After the age of 30, if the tests have been consistently normal, then pap smear with HPV co-testing can be done every 5 yearly also. After the age of 65, usually if your previous tests are normal, we can stop doing pap smears. Hence, I wish that all women become very conscious of their body and do regular checkups and pap smears as and when required. Thank you.